So we're in a lot of pain. We suspect it's a kidney stone because we've had them before, or maybe we've been to the doctor and they suspect, or they've even done a scan and showed that we have a kidney stone, and now they want to do some sort of procedure and they want to try to break it up so that we pass, or they're telling us to drink a lot of water so that we pass it. There are a few things that we do recommend here to support the body system naturally at Magnolia. And if you do have a kidney stone situation, the first would be a stone root, which is in a product we sell called SDR. So stone root relieves symptoms of the kidney kind of spasming. The kidneys will spasm, and that creates a tremendous amount of pain. The spasm is essentially shaking the stone inside of the kidney and causing a lot of pain. That's one of the things that can happen. But the stone root also tones the kidney, and I believe that the stone root can even go in and then begin to kind of break up and fracture some of that crystallization and then help you pass it. We've even had some clients here who do take the SDR or the stone root products, and they actually notice that they feel like a mineral in their urination, which is a good indication to us that something positive is happening, or at least it feels that way while they're taking the stone root. And then after a while of taking that, it actually breaks. They don't feel that anymore, which is a hope in my case that the crystallization is actually being urinated out without there being a lot of pain. One of the other things you can have here, we have a product called Kidney Activator, which has several different herbs in it, including Chanca Piedra. And that is a product that breaks down the stones and relaxes the urinary system. So when the urinary system is inflamed, when the urinary system is hurting, then it's going to be tight and condensed, and it's going to be contracted, just like any other part of your body. If you have a muscle that's sore, it's usually contracted, right? It's even can be contracted so far that it's actually in pain. And so that can happen in the urinary system. And so you want to be able to reduce that inflammation and that pain so that the urinary system kind of swells and opens up further so that you're able to pass that route. We also can do uva ursi. I do recommend lemon water at times, and the reason for that is the citric acid in it is actually positive for breaking down some of the stones. Honestly, hydration is really important, but the stone root has been probably our most successful product for kidney stones of various types and kinds. And we do sell that in a liquid form, which I feel is a lot better. It kind of bypasses the methylation and the conversion in the liver, and then goes straight into the kidneys and does its work. So there you go. And what you would do is you would start with probably the Kidney Activator product in the mornings, or maybe once or twice a day, and then I would recommend the stone root plus a lot of hydration in the evening. And then hopefully by morning, if you do that 5, 6, 7, 8 days in a row, you'll start to see a breakdown of some of that crystallization. Then you have to follow that up by going back to the lifestyle adjustments, and then hopefully if it's something that continues to recur because your body genetically or whatever creates the crystallization, then you're in need to probably go on to some sort of just supplement, general supplement that's also good for throughout the body, as we talked about in the last video, which you're welcome to check out. I mean, you have magnesium in there, which is good for various parts of the body. Probiotics, which is good for every body system because that's how you break down your food, which is your fuel and your medicine. And so there's many things in there lifestyle-wise that you should be doing anyway, not just to reduce your kidney stones. So there you go. Those are the 3 things, or 4, I can't remember now which it was, that we would use to help break down those stones. Again, if the stones are so big that they do not break down, you may have to go seek medical advice, which we are not giving medical advice. We're not diagnosing kidney stones. We're just looking at it as an area we're going to support the kidneys and begin to help them become renourished and hopefully do their job in a way that doesn't allow that crystallization to occur.